In this video, we are going to discuss body fluid compartments. Knowledge of body fluid compartments is essential for any doctor who takes care of patients. So if there's one body of knowledge we'd like you to take away from the renal physiology lectures, it would be knowledge of body fluid compartments. In a normal 70-kilogram human, physiology textbooks say that total body water is 42 liters, or 60% of weight. In reality, this is a bit of an overestimation. Water is most abundant in skeletal muscle and least abundant in fat. So elderly obese women may have total body water that's 50% or less of body weight. Young muscular men may have total body water equal to about 60% of body weight. To make the math easier, and because most basic physiology textbooks use 60% of body weight as total body water, that is what we will use in this video. So in a 70-kilogram human, again, 42 liters of total body water. 1/3 of the 42 liters, or 14 liters, is in the extracellular fluid compartment, and 2/3 of the 42 liters, or 28 liters, is in the intracellular fluid compartment. These compartments are separated by cell membranes. Of the extracellular fluid, 3/4 resides in the interstitium and 1/4 in the intravascular compartment. Now note that intravascular fluid is not the same as blood volume. About 40 to 45% of blood volume is occupied by red cells. That is what's called the hematocrit. So blood volume may be on the order of 6.5 liters, but intravascular water is about 3.5 liters in this example. The interstitial fluid compartment and the intravascular fluid compartment are separated by capillary membranes. We will now discuss what happens when we add fluid with different compositions to total body water. First, we'll discuss what happens when we add 1 liter of isotonic saline to the patient's total body water. By isotonic saline, I mean a solution with a concentration of sodium identical or nearly identical to that of plasma. Normal extracellular fluid contains sodium at a concentration of about 140 to 145 milliequivalents per liter. Isotonic saline contains sodium in roughly the same concentration. When we add 1 liter of isotonic saline to total body water, we expand the volume of the extracellular fluid compartment only. We expand it by 1 liter. And that is because sodium is restricted to the extracellular fluid compartment. We don't expand the intracellular fluid compartment volume at all. Of the 1 liter that's added to the extracellular fluid compartment, again, 3/4 will go into the interstitial fluid compartment, and 1/4 of the extra liter, or 250 milliliters, will go to the intravascular fluid compartment. In a normal human, addition of 1 liter of isotonic saline to total body water should not have any clinically significant effects. However, if one continued to add liters and liters of isotonic saline, there would eventually be pathologic manifestations. Accumulation of fluid in the interstitial compartment would result in pretibial pitting edema. Addition of fluid to the intravascular compartment could cause what we call jugular venous distension, or bulging neck veins. Movement of extracellular fluid into the alveolar spaces could lead to life-threatening pulmonary edema. Movement of fluid from the extracellular fluid compartment into the peritoneal cavity could lead to ascites. We will now discuss what happens when 1 liter of water is added to total body water. Now, we've said previously that 1/3 of total body water is in the extracellular fluid compartment and 2/3 of total body water is in the intracellular fluid compartment. It should also be noted that solute is distributed in the same way. 1/3 of total body solute will be in the extracellular fluid compartment, and 2/3 of total body solute will be in the intracellular fluid compartment. Therefore, when we add 1 liter of water to total body water, water will distribute proportionately between these two compartments because cell membranes are freely permeable to water. Therefore, if we add 1 liter of water to total body water, 1/3 of this liter, or about 333 milliliters, will be added to the extracellular fluid compartment, and 2/3, or about 667 milliliters, will be added to the intracellular fluid compartment. Now, addition of 1 liter of water to total body water of a normal human would cause no clinically significant manifestations. However, if one continued to add liter after liter of water to this normal human, he would eventually get into trouble. Because 2/3 of this administered water is fated to enter the intracellular fluid compartment, this human would get into trouble because of expansion of the intracellular fluid compartment. Namely, he would get into trouble from cerebral edema. Because only 1/3 of this administered water enters the extracellular fluid compartment, he is less likely to develop pedal edema, bulging neck veins, ascites, and pulmonary edema, as discussed on the previous video. To summarize, if one added liters and liters of isotonic saline to total body fluid, the extracellular fluid compartment would be expanded, but not the intracellular fluid volume compartment. Therefore, both the interstitial fluid compartment and the intravascular fluid compartment would be expanded. Expansion of the intravascular fluid would lead to an elevation in blood pressure. Expansion of the extracellular fluid compartment would lead to peripheral edema, to pulmonary edema, and to ascites. When liters and liters of water are added to the total body water, however, the clinical manifestations are much different. Again, 2/3 of administered water will enter the intracellular fluid compartment, and only 1/3 will enter the extracellular fluid compartment. That's because 2/3 of total body solute resides in the intracellular compartment, and 1/3 of total body solute resides in the extracellular fluid compartment. Patients who receive liters and liters of water, therefore, will be more at risk of the manifestations of intracellular fluid expansion than on the manifestations of extracellular fluid expansion. An increase in intracellular water will lead to cerebral edema, which can have devastating neurologic consequences.